Hi, my name is Dr. Eric Martin. I'm an orthopedic surgeon at Orange Regional Medical Group. I graduated medical school at New York University in 1996, followed by an adult reconstructive fellowship. I currently work with the medical group as their specialist in knee and hip replacements. What separates us out from other orthopedic specialists in the region is the attachment of the hospital and the medical group. We've been able to handpick our specialists directly related to what is needed in this area. We have a full complement of physician assistants, nurse practitioners, and medical assistants that also help us round out our team. Orthopedics encompasses a large variety of issues. We have a full trauma specialist team that can fix any fracture. As far as specialized minimally invasive joint replacements, hip replacement surgery involves arthritis. People who have a symptomatic arthritic hip classically have groin pain. Stiffness is very classic with an arthritic hip as well. Our standard hip replacement is kept in the hospital about a day or two after surgery and can usually recover to full activities within a month. For patients who meet the requirements, an outpatient hip replacement can be an option. This involves coming to the hospital on the morning of surgery, having the surgery completed, extensive physical therapy, and being discharged around dinner time. The main impetus to build our medical center in the area at the confluence of the two major highways was to allow patients to have access to care that they no longer have to travel with.